It reflects in engaging and empowering individuals, families, communities for increased social participation and enhanced self-care in health. It reflects in strengthening integrated national health system using primary health care approach to deliver essential quality services with financial protection, with equity-oriented, with gender-sensitive and right-based programming, and to enhance non-state actors to participate in government-led planning, progress reviews, and implementation towards UHC. As mentioned by the earlier speakers, COVID-19 pandemic taught us that diseases respects no borders or socio-economic divides and can affect everyone. Hence, health is one of the few areas in which nations must work together to find common solutions to common problems. Considering the common issues of the Southeast Asia member states, the Regional Director of WHO, CRO, in consultations with member states, identified regional flagship programs synchronizing with the Sustainable Development Goal for Health and Universal Health Coverage Goals. Cooperation through good diplomacy and making timely and right policy decisions are of utmost importance to achieve the goals of these initiatives. As we know, this year's UN General Assembly provides a unique opportunity to leverage political commitments, ensure synergy, and promote a coherent, integrated, and action-oriented global health agenda, as it includes 3 high-level meetings on health, namely pandemic prevention, preparedness and response, universal health coverage, and tuberculosis. This conference today will provide Bangladesh and its regional member states an opportunity to look into issues of common interest through the lens of public health diplomacy and discuss mutual beneficial actions and way forward. This conference will also provide Bangladesh the platform to share its success stories and initiatives they have led on health and well-being, many of which has been already mentioned by the Secretary of Foreign Affairs, and have the opportunity to learn from the participating member states. I take this opportunity to congratulate Her Excellency Sheikh Hasina, the Honorable Prime Minister, for her commendable leadership in health sector, not only at the national level, but at the global level as well, and for receiving as mentioned by both the secretaries, the recognition from the United Nations for the Sheikh Hasina initiative for community-based primary health care, acknowledging the role community clinics play in promoting primary health care, women's empowerment, community engagement, and mobilization towards achieving universal health coverage. Finally, I thank the government of Bangladesh for organizing this conference as part of the celebration of the 75th anniversary of WHO and inviting me and my colleagues from WHO headquarters, region and country to this momentous event. And I reiterate the commitment of WHO for providing best possible technical assistance in health sector to the member states. Thank you all and for being WHO.
Thank you, sir.
Excellencies, now I humbly invite you to watch an audio-visual presentation that will be shown on the screen.
From a war-torn country to a development role model, Bangladesh has undergone a massive transformation. our father of the nation, Bangabandhu Sheikh Mujibur Rahman, recognized public health and nutrition as one of the state's primary duties in Bangladesh Constitution. He initiated a program to set up 10-bed health facilities to take health care to people's doorsteps.
In the field of health, even a minimum measures of medical relief is denied to over 90% of our population. Immediate measures should be undertaken to establish a rural medical center and every union and a hospital at every Thana headquarters.
Bangabandhu Sheikh Mujib's able daughter, Prime Minister Sheikh Hasina, is carrying forward his vision with her own signature initiatives. The United Nations General Assembly has just recognized the Sheikh Hasina initiative on community clinics. In Bangladesh, 14,500 community clinics are now offering services for 6,000 people each. Bangladesh has emerged as a role model of good health at low cost. Prime Minister Sheikh Hasina received UN MDG Award 2010 for achievements in reducing under 5 child mortality rate. Maternal mortality rate has reduced to 161 in 2023 from 370 in 2006 per 100,000 births. Infant mortality rate has reduced to 21 in 2023 from 84 in 2006 per 1,000 births. Life expectancy has increased from 59 in 2006 to 73 in 2023. In 2014, Bangladesh was declared polio-free, with the last person detected with the virus back in 2006. Bangladesh has achieved 94.6% target by 2022 as per National Immunization Strategy. Around 600,000 children have been given vitamin A capsules in June 2023. Around 26 million school children have been brought under deworming campaign. Prime Minister Sheikh Hasina received Vaccine Hero Award by Gavi, the Global Vaccine Alliance, in 2019. Bangladesh is now heading towards achieving SDG 3 with the highest level political commitment to attain universal health coverage. In public sector, 90% of health services are rendered free of cost. The community clinics offer free essential medicines along with insulin. Bangladesh is among the first few countries in the region to place mental health as part of primary health care. High-quality telemedicine services have been introduced for an efficient referral system. Specialized hospitals and institutions are being set up in Dhaka and other divisional headquarters. The Prime Minister herself is advocating for research and innovation in health sector.
বর্তমান যুগে গবেষণা কিন্তু একান্তভাবে অপরিহার্য। আর গবেষণার জন্য তো আমরা বিশেষ অনুদানও দিই। এমনকি আমরা আমাদের বিভিন্ন স্বাস্থ্য মন্ত্রণালয় তো আছে, বা আমি প্রধানমন্ত্রীর যে একটা শিক্ষা সহায়তা ট্রাস্ট ফান্ড আমরা করেছি, এবং প্রধানমন্ত্রী একটা
Under Prime Minister Sheikh Hasina's hands-on leadership, Bangladesh has been recognized as one of the world's best success stories in COVID-19 management. Bangladesh has been credited as an example for mobilizing and administering COVID vaccines under COVAX facility. Currently, over 82% of citizens are fully protected with COVID-19 vaccine. Bangladesh's health diplomacy now aims at ensuring equity and fairness in the proposed international pandemic treaty. In addition, Bangladesh calls for maximizing the TRIPS agreement waivers for developing countries. The country now meets 98% of its local pharmaceutical needs through domestic production. With Saima Wazid leading the efforts, Bangladesh has become a voice for those affected by autism and other neurological disorders. Bangladesh is also advancing work on migrants' health, occupational health and safety, as well as climate impact on health. Bangladesh looks forward to emerging as a regional hub for specialized medical treatment, medical research, and health education. As envisioned by Prime Minister Sheikh Hasina, Bangladesh has much to offer in the area of public health and diplomacy. The country stands ready to work together with regional and international partners to save lives and promote health for all.
Ladies and gentlemen, we are delighted to have amongst us the honorable health ministers from a number of countries in the WHO Southeast Asia region.
Excellencies, now I invite on stage His Excellency Mr. Vijayawad Isara Bhakti, Vice Minister for Foreign Affairs of Thailand, to deliver his kind remarks.
Your Excellency Sheikh Hasina, Honorable Prime Minister of Bangladesh, Honorable Ministers, Excellencies, distinguished participants, ladies and gentlemen. It is a great privilege and pleasure for me to join all the honorable ministers and representatives from the WHO CRO region at this very special event to celebrate the 75th anniversary of WHO, as well as to commemorate our long-standing collaboration and partnership, which have been so beneficial to our peoples. This forum is an excellent opportunity for us to exchange views and best practices on how best to address the daunting public health challenges in our region through public health diplomacy and international technical cooperation. Over the past 75 years, the world has significantly evolved in all aspects. We have witnessed inspiring success stories of humanity through eradication of smallpox, achievement of more effective disease prevention through extensive immunization and health promotion, and better access to quality and affordable health care through universal health coverage, especially for the vulnerable. But we clearly need to do more, especially to invest in both physical and mental health. We need to learn from our own setbacks to perform better and respond more effectively in the future. Excellencies, health is a fundamental human right that needs to be promoted and protected through unwavering commitments. Recently, the international community has shown signs of such commitment through our relentless fight against COVID-19 and other emerging health threats. Together, we managed to emerge from the pandemic and learn to engage with one another with greater solidarity. And during this post-pandemic period, it is now time to rebuild stronger and fairer health systems with UHC at their core. I would therefore like to commend the Bangladeshi government under the leadership of Her Excellency Prime Minister Sheikh Hasina for today's initiative. It is